A very good afternoon, dear listeners. This is Akashvani Kohima at 103 megahertz. This is your host, Tia, in the studio, and I welcome you all to yet another interesting and wonderful episode of our Radio Live Interaction Bilingual program. This program is a continuation of our ongoing series, Drug Free Nagaland program, which is an initiative of the Regional News Unit Akashvani Kohima in collaboration with Nagaland Police Department. So, my dear listeners, I once again welcome you all to our program here. And before I go on and introduce to you our experts, our panelists today, let me quickly remind you that you can find us on our app as well, News on Air app. All you have to do is go to Google Play Store, download the app or install the app News on Air and click on live radio and be part of our program. My dear listeners, as I've mentioned that this is a radio live interactive program, bilingual program. So apni khan questions khan thakishe for our experts, for our panelists, then you can definitely write to us at 9436805333. Don't forget to use the code FM space F 9436805333 de apni khan message korle parebo FM space F la code to ji hule bi dalibi apni la naam bi dalibi jaga ko tibra likhi ase itu bi daligina apni khan questions khan thakishe gule queries khan thakishe gule jani bole mon ke ba thakishe gule ajila experts khan ge hudi bole parebo. Listeners for Mallory, Shamato, Demapoteni, Mon and Twinsang, you are tuning in with me right now at 100.1 megahertz. Listeners from Mocha, it's 101.8 megahertz. Listeners from Peg, 102.1 megahertz. And listeners from Zinaboto, you are tuning in with me right now at 101.2 megahertz. So, my dear listeners, as we all know that Nagaland as a state is in a constant battle with drug addiction, and this discourse, this discussion is the need of the hour. So, my dear listeners, today our experts will shed light on drug addiction, symptoms, and of course the treatment that is required. So, my dear listeners, without much further delay, let me quickly introduce to you our experts today. We have with us right now in our studio Dr. Nuvotso Khesoh, Senior Specialist, State Mental Health Institute, Kohima. Thank you so much, sir, for being with us. We have Ms. H. Pongloi, Deputy SP. Thank you, ma'am, for being with us. And also in our studio, we have Dr. Sungtimen Jamir, Naga Hospital Authority, Nagaland. He is the Nodal officer of Project REST. So thank you, sir, for being with us. So we have experts from different fields. So my dear listeners, if you have any questions, if you have any queries, then do write to us, and you can call us on our number as well. That is 0370224336. So yes, let's get started with our discussion today, with our interactive program today. So we have talked about in our past episodes drug addiction problems kan drug addiction Nagaland man rampant hui jaise. But let's get to the crux of the whole idea. What is drug addiction? Let us know from our doctors today. So Dr. Sungti, can you please tell us what is drug addiction? What is the definition of drug addiction, and what are the types of addiction, and how will you categorize it?
Thank you for this opportunity. The question in itself is actually quite vast, so I'll try to do justice. Before we talk about what is addiction, let's talk about what is a drug. So a drug can be any chemical or any substance. So when consumed, causes a change in a person's physiology, or in our case, in the psychology. So by that we understand that a drug causes a person to behave other than normal, and the use of such drugs we can say that causes addiction. But not all drugs that causes a change in your brain also doesn't cause addiction. But all drugs that are addictive causes a change in your psychology or in your brain, let's say. So addiction in itself is one thing that we should know is that addiction is a treatable and a chronic medical disease. Addiction to any activity or any substance causes a person to perform or to indulge in that substance in a very compulsive manner, knowing its consequences. So the important thing is that they are compelled to participate or indulge in that activity despite knowing its consequences. These activities causes an increase in the dopamine in our brain. So this dopamine is a hormone that gives us pleasure or satisfaction. That's the reason behind addiction, because a person is addicted to that rush of pleasure or that satisfaction you get out of doing that particular drug or that activity. So hence the person develops a pleasure seeking habit. So by definition you can say addiction is a very treatable but a chronic medical disease, and addiction to any substance or activity causes the person to use that substance or do that activity in a very compulsive manner despite its consequences. And when you say how do we categorize the drugs, so categorize, actually we can categorize the drugs in a number of ways, but then let's talk about addiction. So we have this alcohol addiction and then opiate addiction. So under opiate we are talking about the sunflower that is very rampant in our state. Then we have obviously this gambling addiction, then addiction to nicotine, can be cigarette, chewable tobacco or the dips, and then obviously can other, which is not very common in Nagaland, but cocaine addiction and so forth. Then when we talk about categorizing the drugs, then we can categorize it by in terms of legality. For example, some drugs are legal. Let's say alcohol in some states are legal. It's also a drug. Tobacco is a legal drug. Then medicines, which we use, essential medicines like benzodiazepines, codeine, tramadol. These are all legal drugs, but can be abused by the public. And there are some illegal drugs, such as opium, sunflower or heroin, cocaine. These are all illegal drugs. So we can categorize either as legal drugs or illegal drugs. Or by the mode of intake. Say we can categorize some drugs as those drugs that can be taken through mouth, that can be inhaled or smoked, or that can be injected. So we can categorize in that manner also. Then we can also categorize the drug by its source. Some are natural, like opium, and then semi-synthetic like sunflower, heroin, then synthetic like pentazocine, which is not very much commonly abused in our state, but then yes, in some other states they do. Then again, according to the action of the drug on the brain. Say for example, some drugs or chemicals like alcohol, they causes depression in your brain, so it causes sedation. And then opiate drugs like sunflower, it causes sedation. Then sedatives like benzodiazepines, they causes sedation. So those are called depressant drugs. And then there are stimulant drugs like cocaine, tobacco, nicotine, caffeine, amphetamines, yes. So they cause a stimulant effect in our brain. And then there are hallucinogens like LSD, ketamine, magic mushrooms. One thing we should know about alcohol is that alcohol in moderate amount is a stimulant drug, and then in excess amount it is a depressant drug. And then we can also class them according to their chemical composition, like opiate drugs, alcohol, cannabis, stimulants, So it's actually the categorization of drug is also quite vast, very vast.
Thank you so much for trying to summarize such a vast topic in your own words. So thank you so much for that. As Dr. Sungti has also mentioned that it can have effect on the brain and on the body, which is very, very evident. But I want to know from our Dr. Nuvotso that what addiction affects the mental psyche, that addiction has risk on the mental health. Can you please highlight on that area?
Yes, addiction itself is a chronic brain disease, and psychiatric mental illness also a brain disease, and substance use disorder. Addiction. Let me put it in this way, like addiction has two major types. That is substance addiction. For milder terms or neutral terms, we use now the term substance use disorder, not addiction. And there is other addiction, behavioral addiction, which is gambling and internet game addiction and all.
So Dr. Sindhi has said that addiction, any form of addiction, has repercussions and consequences. In spite of the fact that the patient jani ase, this has repercussions, this has consequences. Addiction do grey, or it has an adverse effect on the body. But psychologically, we kinya affect with it.
No, I mean addiction itself. No, I mean it do. There is an area in the brain, we call it brain reward system or brain reward circuit or pathways. It do area though, it's the area which controls how we feel the pleasure, how behaviors, our likes, dislikes, our memory, our emotions, all those. So when we engage in something pleasurable activities, or I mean the brain function, the neurotransmitters, the chemicals working in that area changes. The brain system changes, and that makes a rewarding rewarding thing, and then it needs reinforcement. Thereby we tend to go back to things which we enjoy and things which we like. In that way, with repeated use of chemicals, that the brain changes and it naturally develops addiction in the end. And when the addiction starts, then you lose the self-control, and your functioning, everything hampers your social functioning, impairs your thinking, thoughts. It changes everything. It turns into a different person in fact.
So there are a lot of risk factors when it comes to addiction.
Very much.
So I would like to ask Dr. Sindhi that how does a person start using drugs? Can you please take and how does he or she becomes dependent on drug use? It is a very simple. Normally, kuta kuri le do nakhabole lage, bole bhi khai na. Ar biche nakurubole lage, bole bhi kure. But how does it begins? Na? If you can just highlight the cycle. The vicious cycle, I should say.
One of the most common forms of addiction or ways into addiction is peer pressure. Because of their friends' influence or trying to fit in. So that is a very common way of getting into drugs. And then misinformation. They don't know much about actually what a drug does in your body, or maybe they don't even know that what they are trying to experiment is a very dangerous drug. So that's also one of the things that leads into addiction. Then curiosity. Some people are curious just by their nature. They want to try out. Then obviously some people have addictive personalities. That they are actually very much at risk because by nature they have that kind of personality. And then due to circumstances as well, some people resort to drugs because of circumstances. Let's say a person, very common group of people who take drugs are sex workers. So they may indulge in drugs just to forget about bad experiences in their life as well. So there are many ways to get into addiction. But one thing that we should know is that let's come to a very lighter topic. We should be very much aware that all the drug sellers, all the peddlers, they will sell you the drug claiming it to have magical properties. So very funny incident that I want to share with you is like a person got into addiction not because he wanted to use the drug, but because he was told that taking this drug will help him in his diabetes. And that is misinformation, misguided. And some other people they have taken this drug just because their friends told him that this drug will help him get over his girlfriend, ex-girlfriend, let's say, heartbreak. So we have there are many ways one can be one can get into addiction, but then we should know that so that we should be aware. And one thing that I want to tell the listeners is that before putting anything into your body, first make sure what is it, what it is. No, just don't simply blindly do it. Before we say about addiction, let's talk about drug misuse. So a drug misuse is something when we can define it as use of a drug other than its intended purpose. So for example, if I take a painkiller, for example, a simple paracetamol, to get over, let's say, to stop a headache, then that means it is taken as intended. But then it's also a misuse if it is not prescribed by a doctor, or it is also a misuse if you take it more than it is supposed to be taken. So that's also a misuse. Then there's drug abuse. It is the use of drug in amounts or by method that are harmful to the individual. So in abuse is like, let's say I'm taking alcohol in amounts which my body cannot digest. So that's an abuse. I may not be addicted to alcohol, but sometimes when I drink in an occasion more than the quantity that my body can handle. So that's an abuse. Then addiction. Addiction is more psychological. It causes the person to use a substance in a very compulsive manner, despite its consequences that we have covered earlier. Then let's talk, I want to use a particular word here, dependence. So dependence is something, addiction and dependence is used very interchangeably. But when we medically, when you look at it, a person who is dependent on a particular substance has to fulfill some certain criteria. So for example, a person to be dependent should have these features for at least 12 months, or maybe using a particular drug continuously for a month.
These are indicators.
Those are, yes, the criteria to be fulfilled. And then the characteristic features like strong internal drive to use that substance, and it will be manifested by impaired ability to control the use. So you wake up, you take it in the morning, then in the afternoon, evening, before bed, then even in the middle of the night they have to wake up to take that particular drug. So they don't have control over the use, and then increased priority given to that particular substance over any other activities. So you first have to take this drug or this alcohol before you perform any activity. And then there needs to be persistent use despite harm. So they are using it even though he is suffering from issues like harms doesn't have to be just physical. In his personal life, in his social life, in his professional life. So despite all these harms, they continuously use it, and then it is also accompanied by increase in tolerance. So it used to be this much amount, but then now you have to take more than that amount to achieve a little bit of satisfaction. And then obviously there's withdrawal symptoms, and this is the definition provided by the International ICD-11 and International Code of Diseases.
International classification
of diseases. And dependence is mostly a physical manifestation, while addiction is mostly psychological, that we can say.
Clear description of what are the criteria under which a person falls under drug addiction. So I just wanted to ask ma'am, is drug addiction really rampant in Nagaland as of now? What is your point of view?
Yes, in the early 90s when we were kids, we used to hear about this drug addiction injections, and not only here we see the youngsters like taking these injectable drugs and all, but in recent years, especially in these districts bordering Myanmar, and then like in Dimapur, Kohima, the country, it has increased rampantly. And with the military occupation of Myanmar last year, the Myanmar has overtaken Afghanistan as the highest producer of heroin, and then these heroin drugs are like Nagaland is a transit point for transporting these drugs. It has, since we are sharing this international boundary with Burma in many districts, there's not a single. It's not a single route. We have so many routes. Like it goes from Kohima, Kusama side. It goes to Dimapur. and from parent side it goes, and from PEG side also it comes,
Yeah.
and then coming from this eastern areas like Mon, it comes, it enters, and the border area is very porous because people can just go up to certain kilometers, so, and like that it comes, and then it goes via different routes, and it goes to not only Assam or like the northeastern states. We have history of these drugs being transported to other states, like as far as Punjab, UP. There are like instances like that. So with these drugs, not only with that with the transit point and everything, the addiction, the intake of drug has really increased. And then with this sunflower, which is a cheaper form of drug compared to other drugs, it is affordable for those people who are not doing job also. So like, because since it's cheap and affordable, people easily get into it, and we see that even these youngsters, teenagers are like taking drugs.
So what, according to you, is what specific demographic group of people are more prone to drug addiction as of the current scenario?
As a police, we do not have record like the specific demographics, but then when you look at the trend, the social trend, I think it's the like, if SARS will agree or not, I don't know, but 18 years to 35 years to 40 years, I think that, and even below 18 years, right? Instances like that.
And poor support system, poor family connection, all those are more in the substance use problem.
Frustrated, unemployed, and unskilled.
So I would like to ask our doctors here, what are the methods of treatment used? What are the initial treatment process for an addict? If you can kindly highlight for our listeners, because I feel like a lot of our listeners can drug addiction, what should be the initial step-by-step process, so if you can kindly highlight.
Actually, I think sir will also agree. Treatment will really depend on the severity of the addiction.
Very much.
Whether this person is misusing a drug or abusing a drug, or the level of dependency he has reached. And also it really depends on the type of drug that he is addicted to. So in general, we manage symptomatically. For those who symptomatically as per his complaints. For those who don't show any withdrawal symptoms, so let's say, let's say not withdrawal symptoms, but excess withdrawal symptoms. Like if he's not on the drug, then if he has body ache, then we just give him a mild analgesic, and then we reassure them, or maybe we try to substitute with something else, or maybe we'll try to manage his sleep. But then for those who are showing overt withdrawal symptoms, we have a system, what we call it as a cafeteria approach, wherein we give them options, and then as per their feasibility, as per their accessibility and their past history, they choose that particular method of treatment. Currently, we have this inpatient detoxification, then we have OST treatment that is relevant to our state, OST treatment for sunflower users, opiate users. OST is also the full, it's a short for opiate substitution therapy. Therein we get two medicine, buprenorphine, it's a tablet, as well as a liquid, that is methadone. So this we let them choose as per their, say for example, a person who goes to school every day may not want to be on the OST for a very long time, right? So maybe we'll advise them to detox. Or maybe a person who can come every day but cannot stay as an inpatient because of his office obligations or family obligations, then we put them on OSTs. But either if it is OST or inpatient detoxification, psychotherapy and counseling is actually a very important part of the treatment. I think sir can add as well.
We have to add here. We have to see that options to where, say like some need hospitalization due to risk of overdose or severe withdrawal syndromes, or some other pre-existing problem, medical problem, and comorbid psychiatric illness. Because these substance users, they have a lot of coexistent induced physical problems by the substance use and psychiatric illness. So all those complicated case has to be admitted in the hospital for treatment. And patient with this patient with comorbidity with psychiatric illness and with suicidal ideation and all, this patient has to be admitted, keep under observation. And there are some patient who doesn't have intensive medical condition or psychiatric illness. They require some restricted environment. On this patient can be kept in the residential setting and outpatient program, as Sir Cynthia has said, where no risk for medical problems, no comorbidity, and highly motivated, that can be treated as an outpatient program. And here when they come, we do that treatment for intoxication and withdrawal symptoms. And intoxication ranges from euphoria to severe life-threatening emergency things. So that has to be managed even in the ICU system also. And detoxification, some detoxification can be just social detox program without using any medicine, just psychotherapy, social supports. That is just enough. And for those inpatient doctors, we need close monitoring using of some medicine to detox. And after detoxification, we prepare for the ongoing treatment like motivational intervention, psychotherapy, all those family group therapy, all those mean and relapse prevention. And then we prepare them to even in a rehab center, or even some people they go very well in a prayer center also. And other pharmacological interventions, like some people we might need to put on that anti-craving medicines and supportive medicine. And but yes, treatment overall covers that psychiatric part, medical problems part, and then relapse prevention. And yes, it is actually a holistic approach.
Yes.
The whole spectrum.
Yes.
Sir, on that note, I would like to ask you that doctors definitely prescription they will be taking medicines, but how important? But to continue, not to take drugs. Sometimes it's not just the bodily thing; it's the psychologically we dependent हो जाए मानिस ना. So to maintain that will, that determination, motivate को how important is psychotherapy and counseling?
To maintain that, to keep on abstinence, actually it needs several factors. Support systems, clean environment, and person those who are struggling with these problems, they are very suffering from low self-esteem, low self-efficacy. I cannot do, I'm incompetent, I will not be able to overcome. Very low. So we have to motivate them, we have to keep encouraging them, and we have to seek the health professionals like counselors to keep on counseling and maintaining the spirit high. And yeah, you can add.
Let me supplement. See, in the OST, the opioid substitution therapy, as per NHAK guidelines, for a person to stop OST medication, so the most important part is psychosocial wellness. So they have to, like Sir said, be self-sufficient. They have to be able to do their daily activities without use of any drug, or they should be motivated enough. Then they should not have any social harms. So there's a lot of criteria involved, but then psychosocial wellness is the most important criteria to be fulfilled before we stop the OST. So coming back to your question, yes, psychotherapy is and psychosocial wellness is most important part for a person to be on abstinence or also to give up on a drug. So I think that answers it.
We will continue with this discussion, but let's take a short commercial. We will be right back, dear listeners. We will be back with our program. Meantime, here is a short.
Yeah, I know it's not easy, but I'll try saying yes. Yes to life and no to things that cut it short, my friend. Life is beautiful and it's a gift for you and me. Yeah, you should know life is worth it. Every time, every moment, I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to life and no to drugs. It's the only way. There's no other way. There's no rewind. Yeah, I know. Sometimes people, they feel low, they need a hero. Falling into drawing deep and don't have pathway. No to drugs and no to anything that's a mistake. Yeah, you should know. Just say no, no. Just say no, no. Every day. Choice is yours. I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to love and no to drugs. It's the only way. There's no other way. There's no rewind. There's an anthem in the air, a tune for all to hear, a call that is so strong. I don't wanna see you losing your way. I don't want you waste another day. Yes to living, yes to life. No to hate, no giving up. Say no to drugs. Come on! I choose life. It's a happy choice. Say yes with me. I'm here for you. Let's choose life. It's a happy choice. Say yes with us. We're here for you. Say yes to love and no to drugs. It's the only way. There's no other way. There's no rewind.
Welcome back, dear listeners. This is Akashvani Kohima, and you are listening to our live radio interactive program with our experts here in our studio, Dr. Nuvotso Khesoh, Senior Specialist State Mental Health Institute, Kohima, Ms. H. Pongloi, Deputy SP, and Dr. Sungtimen Jamir, NHAK, Nodal Officer. So yes, we are back with our program here, and as we continue with our discussion, I have a question here that I've received from one of our listeners, for Ms. Pongloi, and the question is: Nagaland Police Department has initiated steps to deal among police personnel using drug and rehabilitation. So how successful that has been? Has the department been able to rehabilitate the personnel? Is there any treatment center set up particularly for those personnel?
The department is trying to recognize those people who are into this from every unit. Namti saya se tahan gina sub unit tiba identify creas actually identify ko gina tahan those who are Some of them have already been like dismissed because she serious case
Okay.
Help kule pare khan ge ta hange rehabilitate under the guidance of our DG. Idu rehabilitation center hange we pay the hange bhi patai bina mohan it try the department bana. Department is trying. See, it's not easy to manuge rigina anigina paigina ina me. Kile gole bishi papo they don't step out. Kha manuge lokai ro. Any society manuge this up to lokai. Paratap we are trying to recognize, identify them, and trying to help them. Na to rehabilitation center hange do ita to bhata do patai is. Hange help to patai.
We were earlier discussing that it is a very lengthy process. We cannot be giving stats as of now.
Yes.
It's in the process. We hope that those personals who have been admitted to the rehab centers hopefully change ho. My next question is for Dr. Sinti. So when a person stops taking any kinds of drugs or abstinence to behavior can, for example, withdrawal symptoms can be as you have mentioned earlier. So in the process, detoxify them, withdrawal symptoms come. What are the steps that we have to take care of, even as someone who uses drugs, as well as for the family members? How can we help someone struggling with drug addiction?
Okay. Can you repeat the question again? It's quite lengthy.
So we just wanted to know that as someone who is suffering from drug addiction or someone that we know, family member will be drugs nalu withdrawal symptoms can be especially when it comes to severe cases. So key steps
Okay. Actually, the question, not many people will because they have not been in this field, so they may not know. But then actually, withdrawal symptoms is actually different drugs have different symptoms. So I cannot just give one answer for that in general. But then let's talk about sunflower because that is very rampant in our state. So it's an opiate drug to begin with. So most opiate drugs, withdrawal starts after 6 hours of last intake. So after 5-6 hours, they will want to take. Okay, so some of the withdrawal symptoms that we should look out for is, and then the local term for withdrawal is turkey, the bird turkey. Yeah, Thanksgiving turkey. No, that is because just like the bird turkey, which is a lot of perforation on the skin, we start getting goosebumps.
Okay.
Then we started experiencing runny nose, excess of tearing, excess of salivation, then body ache, loose motion. So these withdrawals actually cannot be stopped unless and until they take an opiate drug or a substitution drug. Okay, or maybe if they come to a hospital. Until and unless they do that, it's impossible to stop a withdrawal. Like say for example, this particular person has excess of body ache, let's say. If you give him paracetamol, it's not going to work.
It's not going to work.
Yeah. So for any listeners, if you know, if you are using drug and if you want to stop, then you can come to any hospital. And then if you are afraid then of withdrawals, or if you are unable to come, then it's okay. You can maybe if you after your last intake before 6 hours reach us. Then we can formulate a plan. Yes, but then let's as per the question, we cannot simply say that you have to do this because different drugs have different withdrawal symptoms. Like a person who is dependent on alcohol will start shivering, will start hallucinating, and if you take a glass or a pack of alcohol, then everything will go away. No, it's like that.
So every drug has different
withdrawal effects.
Bottle it down to one particular symptom. So best thing is, if you know anyone or if you are one of them, then best thing is you go for medical intervention. That is the best thing that you should be doing. So is there any helpline, if any drug user wants to reach out, is there any assistance by the department, or is there any helpline?
Nagaland has the highest OAC center in the whole of our nation. There are 56 OSC centers or satellite centers, and more are coming up. So that means one is just near you, let's say. So every district hospital will have one, and almost all most of the PHCs or CHCs they have an attached OSC center or a satellite center. So please go to your nearest district hospital. Number one. Number two is that if you want to get yourself detoxed, I don't know how many hospitals perform inpatient detoxification in our state, but then we have our detox center in Naga Hospital. I would like to give you the phone number here. It is 8974098255. I'll repeat again, 8974098255. So you can call to this number and get an appointment for detoxification as well. And then we have this Project Rest, but then this is mainly for those who are on abstinence and who need psychological support. So you can contact here in NHAK as well. So the number is 9366990275. So that is for Project Rest. This is for those who are on abstinence. And then we have a lot of NGOs in our state as well. So we have Kripa Foundation, to name a few, ARC Foundation. So you can contact them as well if you want to, if you need some help, some guidance. They have a lot of outreach workers, peer educators. So you can contact them as well. And then you can also contact the state mental health hospital.
Yes, we have a very important helpline, toll-free number. We call it Telemanas. It's a national toll-free number, helpline number, especially for substance use and mental illness. Telemanas full form is a mental health assistant networking across states. So it is actually 24/7. You can call at any time, any place, anywhere. And for Nagaland, we have a Telemana cell at State Mental Health Institute. Presently, we are working from 9 to 4:30 only. But in few days or months, we will make it into 24/7. Patient, those who are suffering, they can call at any time and then ask for guidance or counseling, motivational interviewing, also done. They can give direction to the nearest centers, as Sir has already. And it comprises of 10 counselors, 1 psychiatrist social worker, 1 clinical psychologist, and 2 consultants as a psychiatrist. So this toll-free number is 14416. Toll-free number 14416. This is the number you can call at any time. Yes.
So there is help all around you.
Yes.
All you have to do is take the first step.
I would like to add to that number. This is national toll-free number that is by Ministry of Social Justice and Empowerment. This is 24/7 toll-free number. This for drug. This is drug de-addiction helpline number 1800 110031. That's the number. 1800 110031.
So you can call any of this number and seek help and look for help. So, Doctor, my next question is for you. What role does genetics play in the susceptibility of drug addiction? Are kids or are babies or infants more prone to develop drug addiction if their parents are also users?
This in itself is a very vast topic when it comes to genetics. It's a very interesting but very, let's say, technical subject. But then let's, in short, we can never find a single genetic change that will cause addiction. But then there's a lot of genes involved to give a person, let's say, a particular trait. So obviously studies were done. Studies are still being done. But then people with substance use disorders can have different underlying genetic causes. It cannot just be one. And people who share certain high risk genes may or may not have the trait. So even if I have that particular high risk gene, I may not show that particular disease as well. So we cannot pinpoint it, 100% say. But then yes, there are genetic manifestations. Some studies have suggested that a person's genetic accounts for 40 to 60% risk of addiction. That's also there. But then again, we cannot say it's, since you have that particular gene, that means you are supposed to be addicted. We cannot say that. And obviously, more than genetics, environment factors is more important when it comes to addiction.
Very bad.
So sir, can mental health disorders contribute to the development of drug addiction?
Yes, there is always a comorbidity. A person suffering from mental illness, 50% of the person suffering from mental illness have substance use disorders, and 50% person of substance use disorders have psychiatric illness.
There's a codependence.
So the 50-50 vice versa. And it is very common with anxiety disorders, depression, bipolar disorders, post-traumatic stress disorders. All those, they are very much associated with substance use.
So what are the preventive measures that one should take to reduce the risk of drug addiction?
It's been very well documented that humans have used psychotropic substance since the BC. So the earliest, I don't know, some 800 or 600 BC, it was so. The documents are there. So we cannot say that, all of us should stop taking drugs. That is because it's, it's in our human nature in itself. It's there. But then some of the measures that have been taken, we can say that there is an effort by the police department to reduce the supply. That's what we call it as supply reduction strategies. Then obviously we create awareness programs. So that's what we call it as demand reduction. So we try to tell the children. And then now the latest strategy, is more aimed towards the harm reduction. So we have to acknowledge that there will be always some group of people who will take drugs. A group of people will always continue taking alcohol, or tobacco. But then we have to educate them regarding the harms or help them prevent harms. Say for example, drug users, if they indulge in injecting drugs, then there is risk of transmitting bloodborne diseases. So we have to tell them that you better stop taking injecting, or we'll teach them how to do it better, or we give them fresh needles, or we tell them not to share the needles with them, so that we're trying to reduce the spread of HIV or hepatitis and so forth. So there are actually the government is implementing a lot of reduction, harm reduction or supply reduction, demand reduction programs, and they all have to go hand in hand. And for this, I think all the different departments involved have to work together.
I would also like to supplement to that one. I think that younger generations now, some of them are educated but unskilled, because only writing does not make you a skilled person. Frustrations, depressions come together. So of course government has so many skill development programs and trainings here. Many people are not aware also. To keep them distracted or to keep them occupied away from these substances and other things, it is skill training to give them encourage or encourage them in other recreational activities like sports, that will also help.
So, ma'am, on that note, what is the legal status of drug influence rates in Nagaland?
Influence rates.
Maybe what is the legal status, if you can kindly highlight?
Drug to in India we have this NDPS Act 1985. Actually, even consumption of drug is punishable. And then to procure drug by there is this small amount, punishable up to 6 months, or commercial amount. Then we have this that amount between small and commercial. Our commercial together. This punishment and in the legal sense it's very strict. She's strict as well. The punishment can go up to 10 years or even 20 years. Now sometimes, and then this the fines bit hero. So it's very strict legal aspect very stringent. But the problem is that mohan see drugs. So we try to, as a law enforcement agency, we are like trying as much as we can. But the thing, one informant can keep procedure but this every law has a procedure. Na to ekta procedural lapse thakile problem ho jay. So it do like this right now we are taking this department is taking this drugs war against drugs very seriously. So we have a team sub form Kohinas na. So tade we are training different personals, different teams, training PSA to that process of in the court also the conviction has to be there. Not only aji paishe thurishe khatam itu the conviction also has to be there, but the procedural issues so we're trying our best.
This is indeed a very interesting topic, Ajula, drug addiction symptoms and treatment, as we have discussed that very vast. Since we are running out of time, if we continue with this, we want to continue with our discussion, but hopefully in our next episode we will do that. But as we are nearing to the end of our program here, is in your own words, very short messages to our listeners. Let's start with Dr. Khesoh.
For general public, try to educate yourself with substance addiction, the consequences, and ignorance shouldn't be the reason to judge others. And for those who are suffering, you don't have to struggle alone. We will fight your fight together, because this addiction is not only your problem, it is our problem. So we will fight the battle and we will win.
Madam?
I would like to say to the listeners or those who are taking it, I would like to say is like communicate. You communicate, seek help, get help. And another thing is prevention is always better than cure. And for youngsters, have hobbies. You will have things to do that will keep you occupied.
A wonderful message. Let's come to Dr. Sindhi.
Like I've said earlier, don't take anything that you don't know what is it. Yes, so that's one thing. And number two is that these days, times have changed so much. Earlier on, and even now, there are big posters on the streets saying "Say no to drugs" with a big injection on it, right? But with a big syringe on it, right? But the problem is that these days, drugs comes in many forms. The sunflower that we talk about is usually or most commonly smoke, or the smoke is inhaled. So maybe if your friend or if someone is offering you something that you don't know, just because you are smoking, that doesn't mean that that you should try that as well. And number two is that even the parents should be educated, because maybe you're suspecting your son or your daughter is into recreational drugs, but maybe they are or maybe they are just smoking at home, but maybe they are into more sinister habits. But just because we are unable to confront them, or we are unable to help them because we ourselves are not educated. So first we need to educate ourselves and then help those who are in need.
Thank you so much, madam and sirs, for your wonderful message. At the end of the day, it is about being informed and informing others. Many times our own parents are clouded with our own judgment that we fail to see. But thank you so much. We had a really informative session. Like I said, this topic is something that needs to be more discussed, and I don't think we are able to consolidate in one episode, but hopefully we will see you again in more episodes. With that, we come to the end of our program, dear listeners. Once again, let me remind you of the helpline numbers that the doctors have given us. The Naga Hospital, for appointments you can call at 8974098255. For Project Rest, if you are going through the abstinence process, then you can call at 9366990275. And for Telemanus, that is mental health assistance, you can call at 14416, and for social justice 1800110031. And also not forgetting that if you have or if you come across anyone or if you know anyone for any kind of information, for any kind of complaints that you want to register. It's totally anonymous. You can use the app Call My Cop or Make My Nagaland app. So with that, we come to the end of our program. Thank you so much for joining all of us. Thank you so much.